Namaste. Welcome back for a Facebook Live session 8 on COVID complications and treatment options. Myself, Dr. Vishwanath, consultant physician and diabetologist. Today I will share with you the authentic information on COVID complications and treatment options. I'm not speaking to a medical professionals. It is for the common man perspective, what people must know about a COVID complications and treatment options. So based on my experience of seeing COVID inpatients, COVID outpatients, I will share this information, and once you know the proper information, your fear will go away. So earlier also I did many Facebook live sessions and I discussed about symptoms, tests, what are the prevention measures, other things. So I'll start with, suppose somebody has a COVID. What are the problems, what symptoms they have? So many people have this confusion. So the common symptoms of COVID are fever, feverishness, a body pain, too much of tiredness, a cough, sometimes loose motions, sometimes loss of taste, loss of smell, breathing difficulty, and so on. In this, the most consistent features are, one is feverishness, a cough, any cough, dry cough or a wet cough, and a tiredness. So make it a note that all symptoms need not be present in all people. Like for example, some people just have only tiredness and a cough, and some people have only sore throat and a cough. Some people have very mild feverishness but too much of tiredness. Here the point to be noted is, all of you know how the flu symptoms are, viral flu symptoms are. So in a pandemic like this, when the COVID is in the peak, it is really very difficult to differentiate between a normal flu and a COVID. So my suggestion is, if you have any flu symptoms, better get tested for a COVID. Like some people have just only allergic symptoms like sneezing, nose block, nothing else. That is not COVID. That could be a pure allergy. But apart from that, any normal flu symptoms like cold, running nose, sore throat, cough, fever, body pain, any normal flu and COVID is very difficult to differentiate. Sometimes can be differentiated. Somebody has a loss of smell, we can directly say, oh, it's a COVID. And somebody says too much of tiredness, a loss of smell or loose motion, we can say it's COVID. But many times it's difficult. If you experience any flu symptoms, please get it tested, because if you don't test it, through you infection can spread to others. Hi all. Second thing, suppose if you have a very mild symptoms, you cannot able to test it. The best thing you can do is take some symptomatic treatment and isolate yourself. By isolating, you are avoiding the spread of infection to the others. So this is about how the COVID present. Second thing about the tests. So again, there is a confusion. There are so many tests are available, modalities of tests are available. So the two commonly used are antigen test, the swab antigen test, and a COVID RT-PCR test, and an antibody test, and sometimes CT scan. I'll first come with the antigen test. What happens antigen test? Antigen test, they will take a swab through nose and throat, sometimes only through nose. And this antigen test can come positive in only 50% cases. That means it can detect only 50% people who have a COVID. Another 50% people, even though they have a COVID, may not be detected in this test. Suppose you did an antigen test, it comes negative, then we'll do the COVID RT-PCR test. So RT-PCR test is the gold standard. So it can detect up to 70 to 80% cases of COVID, again through swab, nose or throat. Some people have a typical COVID symptoms, but RT-PCR comes negative. Even the RT-PCR test comes negative. And if you're strongly suspecting the COVID, then I suggest to go for a CT scan, HRCT of the CT chest. This HRCT of the CT chest can detect many times a future similar to COVID, suggestive of COVID, when the RT-PCR test is negative. And somehow there is a lot of people are marketing, many labs are telling we do antibody test. Remember this, don't use antibody test for a diagnosis. It's only for the community surveillance. Don't use antibody test for the diagnosis because it's always confusing. So the first two tests are antigen test, RT-PCR test. If these two tests cannot detect COVID, if you're still suspicious, you can go to the CT scan chest with the advice of a doctor. Don't go to CT scan directly. This is about the tests. And okay, once your COVID is confirmed, so next, what to do? So suddenly so many things come to the mind once the COVID is confirmed. Whether to get home isolate, whether to get admitted, or whether to take just online consultation and take some medications. So here, first you have to know whether your COVID is mild, moderate or severe. Suppose you have very mild, minimal symptoms. So very mild flu symptoms and you are young, if you feel that your immunity is strong and there is no tiredness and your oxygen saturation through pulse oximeter is almost normal, above 94, then you think of home isolation. And remember this, while doing home isolation, don't compare with others. Many people think that my friend has got home isolated, he didn't admit, he recovered in 1 week. And one of my friend has got some Ayurveda treatment, homeopathic treatment or some other treatment and he's just take vitamin C, zinc, he recovered. And don't compare your status to other status because everybody is unique and everybody's immunity is different. So if you think that your symptoms are mild, you consult a doctor online or consult a doctor in any COVID hospital and get reconfirmed that your symptoms are mild and nothing to be worried about. Don't take a self decision or don't self medicate because if you enter a hospital in a complicated state, it is difficult to treat and many people doesn't respond to the treatment. So even if you think your COVID symptoms are mild, get an opinion of the doctor at least through online. Second thing is moderate to severe. So in the moderate to severe category, suppose you have on and off fever, you have a cough, you have a tiredness, you feel that something unusual, I cannot manage myself. And suppose if you are a diabetic, hypertensive, cardiac problem, you're an asthmatic, and you have some other health issues, and you are obese, if any of these comorbidities are there, then you have to do some tests to confirm whether your disease is mild, moderate or severe. To explain in simple terms, the basic test you must do is, one is a blood count CBC that everyone should know, and second thing is CRP, C-reactive protein. Like we all know in dengue, everybody know what is a platelet. Whenever somebody admitted in dengue, the doctors keep checking the platelet. When the platelet curves go low, they keep telling you, so the platelet is countly, every day they check the platelet. Similarly, just like the platelet count in dengue, CRP is a very important lab test to be done in all COVID patients. Here, normal CRP is sometimes less than 6. If your CRP is more than 10, then it's a sign of alertness. I have seen in hospital many people having CRP starting from 10 to 200. And if your CRP is above 50, definitely you need a repeat CRP after 2 days and you must consult a doctor. And if your CRP is above 7500 and if you have cough, fever and all, I suggest better to get hospitalization, and CRP is one of the important marker in a COVID test. Just like platelet count in dengue, remember CRP in COVID. And second thing is, when you are having oxygen saturation less than 94, for example, at rest your oxygen saturation is 94, 95. After walking for 6 minutes, it is dropping to less than 92. Even then, it indicates that the lung involvement, you have to be hospitalized. So don't delay the hospitalization, because in COVID, the 3rd to 8th day is very, very crucial. This is the time many people get complications. If you neglect this time, mostly you'll end up in a hospitalization with the complications. So this is about hospitalization. Then, so what happens? What are the complications of COVID in a common terms? So many people, 80% of the people will recover, have mild symptoms of COVID. So they recover without any much complications. So another 15 to 18% have complications. They undergo a course in the hospital and they recover. And less than 3%, 2% people may die of complications and all. So what is the common complication of COVID? The common complication of COVID is pneumonia. Sorry, there is a poor connection. So in these two things are only the COVID virus cause either infection of the lung called pneumonia, or second, this COVID virus can cause a clot formation in the lungs, and that can lead to low oxygen levels. So that's why the checking saturation, the oxygen level through pulse oximeter is very, very important. So this is about a COVID pathophysiology. So 90% people have the complicated COVID, matlab they have a pneumonia. That means lung infection. Very rarely in COVID, people also get heart attacks, strokes, too much of fatigability, and other very less common complications, less severe complications like loose motions, loss of taste, loss of smell, or less severe complications. The most severe complication is pneumonia, that is leading to ARDS, that is acute respiratory distress syndrome. And second thing is your oxygen level goes low. And when you admit in a hospital, what are the course of action? You must be knowing something what the doctors do in a hospital. So when you admit in a hospital, usually the 3 categories of medicines are given. So suppose after admitting in a hospital, your oxygen saturation is above 93% and you have a mild symptoms, then what they do, they give antiviral oral medications, they give a blood thinners, and sometimes depending on your situation, they also may give steroids. And suppose your oxygen saturation is less than 93% and you have some lung infection or pneumonia, then one more drug called as remdesivir is given. This is one of the promising drug in the COVID treatment. This is given for a moderate to severe cases, not for all the mild cases. So this is injection as a 5 to 10 days course. This is given only in the hospital settings. So again, along with that, blood thinners, steroids, and other symptomatic medicine like vitamin C, vitamin D, zinc, sometimes folic acid. So these are the 4 supplements which are very essential for a COVID patients, because that helps in developing immunity. Even to prevent the COVID, to have a good immunity, vitamin C, zinc, vitamin D, and folic acid, sometimes vitamin E are very essential. Suppose after admitting in a hospital, you have a pneumonia and your saturation is drops to less than 90. Then what to do? The first thing that done in a hospital is they give a oxygen through nasal prongs or through face mask, or sometimes if oxygen requirement is like more than 6 liters, 8 liters, and even if they give normal oxygen you are not able to maintain, they give a oxygen through a non-invasive ventilator. These are the machines which assists your respiration. They use it in a hospital. For a very severe cases where nothing is going to maintain your oxygen levels, they give a high flow oxygen in that machine. They give you a 20 liters, 30, 40, up to 70 liters of oxygen. So this is the first time the virus will require so much of oxygen, because it will clog your lungs and make this entire lung infective. Many people requiring 40, 50 liters of oxygen for many days. Suppose even that also cannot maintain your oxygen levels. At the end, they may suggest to put you on a ventilator machine. In a severe cases, they put you on a ventilator machine. These are all the treatment options. One is they give antiviral medications. Second thing, they may give steroid medications. Third, they give me blood thinners, because COVID can cause blood clots. And third thing, to maintain your oxygen levels, they give you oxygens. They will give you non-invasive ventilations. They will give you high flow oxygen, and they give you ventilator support. These are all the treatment options at a different grades. It depends on the clinical judgment and on the patient's severity. Not all patients require all the treatment. Many people just admit and take treatment for 2-3 days and they discharge for a home quarantine. Some people require home oxygen for 2-3 days, they recover. Some people may high flow oxygen, they may prolong the hospital stay for 1 or 2 weeks, they discharge after 3 weeks or 4 weeks. So the complications are less, the complication rate is less, but these are all the treatment options. And people who want to try Ayurveda, homeopathy and other things, so I don't know much about those things. If you have a mild symptoms of COVID, I suggest you to try all those things. But if your symptoms are moderate to severe, your oxygen levels are not maintaining, then better not to try these methods. So because any acute severe conditions, allopathy is the better, you can try that. In a mild to moderate cases, if you are comfortable and if your medical treatment is proven and have a proper follow-up, you can go for the other modalities of treatment. And sometimes what happens, a patient of a COVID admitted there, many people think that my sugar levels are going high. So I never used to take insulins, my sugar levels are going high. Because after admission for the COVID, the sugar levels are go high because COVID itself can raise your sugars. And sometimes in a moderate severe cases, they give steroid injections in the hospital. Even that can cause high sugars. Sometimes sugar may go $300, $400. So to reduce these high sugars, sometimes hospital may give, the doctors will advise to give you insulin. That's only a temporary phenomena. And some people also complains of high BP. The high BP may be because of anxiety and for the disease itself. Even that's also a temporary. After some time the BP comes to normal. So this is about a complication, some of the treatment options for the COVID. Don't think that all COVID cases are same. It is a very uncertain disease. And most vulnerable are the people who are getting complication are, one is a obese people, a diabetic people, hypertension, cardiac problem people, and people who have a micronutrient deficiency. So this is the very important. Many people in India across the world are deficient in micronutrients. The micronutrients are vitamins and minerals, because over the last 30 years of study, the day by year to year, the micronutrients content in the vegetables and fruits are decreasing. Because of this, many people are deficient in micronutrients, vitamins and minerals. And if you don't have a proper micronutrients in your body, then the body's immune response will become slow. And when the immune response is slow, you are succumb to complications. That's why, so these two categories of the people are most likely to have complications. That's why taking supplements is sometimes very important in this COVID times, especially vitamin C, zinc, vitamin D, and folic acid, sometimes vitamin E. So this is in brief about a COVID complications and the basics of treatment. And I will answer your questions. If you have any questions, ask me. Anything related to the COVID, I'll answer today. Good evening, Saurav. Good evening, Rohi. Hi, Lokesh. Adarsh, Kiran. Adarsh is asking, so tell about herd immunity. Herd immunity is unknown exposures, people exposed to the COVID antigens, and they may not develop a symptoms, and they develop antibodies. So as the more and more people are getting COVID, there's also a spread of COVID in the community, and the developing immunity in the community, that's called as herd immunity. The immunity of the community is called as a herd immunity. Hopefully, when the number of cases become more, gradually the herd immunity also becomes more. Hi Swaroop. Hi Harish. Hi Shilpa. Hi Kumar. Any questions? And second thing is, when is COVID going to end? And Mohan is asking, when will have a vaccine? This is an important question. Many people are waiting for the vaccine. Most likely the vaccine may come in November or December as the things goes well. But when the vaccine comes, the first is it given to the high priority people, maybe people who are working in the hospitals, healthcare workers, defense, and corona warriors. And for the common public, it may be available in the 2021 first half. Second, the question from Lokesh. Sir, how many days after symptoms should one go for an antibodies tests if the person have infected earlier or not? After 3 weeks of COVID infection, you can go for an antibody test. Suppose there is one more treatment option in the COVID is called plasma therapy. That means when other medications like remdesivir is not working, they also give a plasma therapy. So just like we are giving a platelet in the dengue, here they will call plasma. That means the infected person of the same group who are recovered and who have antibodies can donate their plasma, so that donate their blood, it is separated into a plasma and give it to the COVID patients. This is not given for all the patients. For severe patients or in ICU, the plasma therapy is given. In such patients, usually the person should have recovered from the COVID from the last 20 days, and within 20 to 40 days, they can check their antibodies, and if they have a good antibodies, they can donate their plasma for the severe infected COVID patients. Question from Vilma. Sir, our staff is discharged as COVID negative, but he says he has pneumonia. Is it safe? It is not maybe pneumonia. It could be a post-COVID complication. As I said, in the COVID, there is an inflammation and a microthrombi, and because of this inflammation, this post-COVID symptoms like tiredness, cough, exertional fever, and some patches in the lung will remain for some more time. They may not be infective to others, but they have all these symptoms up to 100 days after COVID. Question from Shilpa, can we give immunity tablet to a person who have not a COVID patient? Yes, as I said, immunity is very important. Immunity is, if you have immunity, doesn't mean that you won't get infected with the COVID. Anybody can infect with the COVID, but after infecting with the COVID, to recover from the COVID, you need a good immunity. For that, you may not get all the supplements through normally or diet. I suggest to give vitamin C, zinc, vitamin D, folic acid, and vitamin E supplements, and even sometimes ashwagandha, spirulina, some Ayurvedic supplements also can be used. But use with a caution and a consultation, because you cannot take so many supplements and become 5-6 supplements. Use judiciously in a proper ratio and a proper dosages. Question from Kiran. I got this from my friend. Please suggest if below helps prevent from the COVID infection. Question from Maruti Prasad. Once patient is diagnosed with a COVID pneumonia and discharged, is there a chance of getting mild fever? Yes. Even after complete recovery from the COVID and discharge, up to 40 days, up to 2 months, there is a chance of getting a mild fever. This is not primarily to infection. Many times it is because of the inflammation. Suppose after recovery from the COVID, people do some work, they feel feverish. People go for a walking, they feel feverish. This is a mild fever can be there in after recovery of the COVID for up to 40 days. But if you have a high fever after discharge recovery, then you must meet a doctor and get your checked whether it's because of COVID or non-COVID. Question from Nagashri. Government is thinking to reopen schools for higher classes. How much is it safe to send them? I think how long to keep everything closed? It's already 6 months over. It's a time to reopen court. We're making a standard precautions. All the social distancing, masking, all the precautions to be opened, and the school has to be opened. Question from Ganesh. Is there a possibility of getting infected by the virus again for the infected person for the second time? Ganesh, out of the nearly 26 to 27 million cases reported all over the world, there are only 6 cases of reinfection so far. In the 6 cases to reinfection, recently we have heard there is one reinfection case is in a 40s. Remember this is not a confirmed case of reinfection, because to confirm a case of reinfection, that has to go for a gene analysis, because the virus of the first virus gene and the second virus reinfection gene, if the matches, then only we can call it's a reinfection. But only so far reported is 6 cases out of million cases so far. The reinfection is extremely rare, and as of now, don't worry about it. Hi Venkat. Kiran is taking Force Plus, Tab Limsi 500, Zincovid 550, Zincone 50, folic acid 5 mg a day. It's okay, Kiran. It's fine. You can continue that. But there are many other brands. No, in all of this, there are many brands come with a combination. You can use that also. Thank you, Shilpa. Question from the Bhagya. There are cases of reinfection. What care should be taken? As I told, the reinfection is very, very rare. Out of million cases, there are only 6 cases of reinfection reported in the world. As of now, nothing to worry much about that. So question from Likint. I am getting cough and sputum after having food every time. What might be there? It's only after food. It may not be related to the COVID. It may be related to your reflux or something related to allergy. So Shilpa is asking, if has to reopen a school, my request is to please give us one more session how to send a child to the school. I will definitely make one session about children's. As of now, remember this, COVID and a normal flu is almost same for the children's. The children don't have a severe disease. Commonly 99% of children doesn't have a severe disease. Even if they get a COVID, it is like almost like a normal flu. Nothing to worry much about that. So question from Bhagya, how many days can antibodies will be present in a COVID positive patients? Remember, the immunity for a COVID after infection, it depends on the many factors. One is IgG, IgM antibodies. Second thing, T-cell immunity. There are so many antibodies, immunity factors. What antibodies you measure in the lab, they are not the only deciding factors. Many people with the antibody negative also are immune to COVID. So these antibodies may last up to 3 to 6 months. They peak up to 3 months, maybe disappear up to 6 months later. But this antibody test itself is not reliable. Question from Sheetal. If we get fever and then do not get it for 3 to 4 days and go for a COVID test, what are the chances of getting COVID positive? It can be, as I said, 20% of the COVID people may not have fever. So it's there in 80%. And fever doesn't mean that you should be having, some people in the COVID have a fever for 1 day, 2 days, 3 days, 10 days, 40 days. Many people just have a fever for 1 or 2 days. I suggest if any fever is there is a strong suspicion of the COVID, and you consult a doctor. They have to decide clinically whether it is a fever of COVID or a non-COVID, and there is a chance of COVID. In this COVID time, any fever to be seen as a suspicious of COVID only. Question from Prabhu Swami, when can we expect a vaccine? Most likely November or December. So there are many trials are going on. Most likely November, December vaccine may come. So question from the Kiran. Thanks Kiran. Thanks for appearing live and asking questions. It will be useful for many others. So if any other questions, you can type it here. I can answer later also. If not, I can close the session. So there are so many messages in the WhatsApp, Facebook. Most messages will scare you. Though the things happen like this, then so. One thing is, don't get scared of COVID. Get a authentic information about COVID. I'm sharing these informations based on my clinical experience as a physician working with the COVID patients, and myself infected with the COVID 2 months back and recovered. So all these things are authentic informations based on many studies and all. So share these informations, share this video to your friends and family so that they need not get scared. The complications and a death in COVID is very rare. It happens only 1 to 2% people, but sometimes it's uncertain. I have seen recently, today I discharged one patient of a COVID who was 120 kgs. He recovered completely within 5 days and discharged. But many people in a young age like 35-40 years also have complications. Sometimes the COVID is a very uncertain disease, but don't get scared. COVID is an opportunity. COVID is an opportunity for you to improve your health and immunity. All these days, people who are not serious about health, now at least get serious. Your immunity is very, very important. If you're immune, whether to get a COVID or not, nothing to worry. And some more questions. Question from Shilpa, prophylactic ecospin helpful for high risk group. If you're already taking ecospin, continue that, aspirin 75 mg, but there is no evidence or no guidelines to say that prophylactic ecospin to be taken for the COVID patients. Question from Maruti, 63-year-old male with a diabetic can donate plasma without any worry about his health. Usually they won't take blood after 55-60 with the diabetic people. Need to check with the blood bank about the criteria. Question from Hajira, regarding flu vaccine, whether it is required to be taken, please suggest. The normal influenza vaccine can be taken yearly. It will protect against other flus. It can be taken once in a year. So this is in brief about a COVID update. I'll come again after some time with some more update. So get authentic information. So be fearless. Though COVID is uncertain, the complications and deaths are rare, and give a more focus on prevention and improving your immunity and overall health. Bye for now. Good night.